we get patients that, you know, have gone out of the country, and the draw is that they're going to get them in 3 days. You're receiving a treatment that you want it to be with you for many, many, many years. So, you know, thinking that it's so critical that you do it in 5 days versus 20 days or however is in my mind really being kind of penny wise and pound foolish. You know, you want to make sure that you get the right product, and generally that's going to take a reasonable amount of time. And what I mean by that is there's the planning that goes into it. If you're getting those veneers in a week, there's really very little planning. You go in and the teeth are prepared and you're going to get whatever is their standard look. And you may or may not like that. And you really don't have a chance to have input as the patient as to how they're going to look. So in our process, we go through a process of preparing where we take a lot of pictures, we do videos, we see what the patient's phonetics are like, and so that when we design the veneers, they're going to match their face. So there's the design process. Then once we have the design process, then we're going to prepare and place that design that the patient saw and agreed upon on their teeth as provisional restorations. So now there's a period of time where the patient gets to live with those provisionals and decide, hey, I like this, I don't like this, I want this longer, I want this shorter. And so we work together to finalize what the overall veneer is going to look like in their provisional veneers. And that may take a week, that may take 4 or 5 weeks if somebody, you know, is not sure how they want this to look, and we keep making little changes. But that's the period where I think it's important for the patient to have input, for the patient to know how their veneers are going to look before they're put on. I mean, we hear every day that patients had no idea how they were going to look. They put them on, they never got that comment, or they never got to know if they liked them, and boom, the veneers are on and it's done. You know, so we avoid that. So what we do probably takes a little longer than in most offices, but the patients are involved in the choice, and we use very high quality labs when we're doing it, and because they're high quality, they don't rush their work, so they're going to take a little longer. So I don't think a major criteria in decision making should be how quickly can I get them. I think a major part of that decision should be, do I know what I'm going to get before I get it? Do I have input into how they're going to look so that I know I will be happy with the end result? I think these are questions that people often don't ask themselves, and I think it's really critical that these are things to be considered.